Today we're going to learn about Medicare enrollment periods. Now, enrollment periods can apply to enrolling in Medicare itself and certain Medicare Advantage plans and Medicare Part D plans. And our focus is really going to be on those enrollment periods to get in and out of the Advantage plans and the Medicare Part D plans. So let's move on to our next slide here. Now, just like I said in the previous slide, there are specific time frames when you can sign up or change coverage. And that really depends on what you're trying to sign up for, because some enrollment periods are, again, just to get into Medicare, and others are for private insurance. Now, prior to 2006, we didn't have enrollment periods. That was an invention of the Medicare Part D program. Now, for enrolling in Medicare, there is a 7-month IEP, and IEP stands for Initial Enrollment Period. Now, as a Medicare insurance pro, you should be most familiar with this one because this really indicates the people that are about to turn 65, or if they're disabled, they're going on Medicare automatically. But the initial enrollment period for Medicare is 3 months before Medicare eligibility, the month of, and 3 months after. Now let's look at another enrollment period that Medicare has called the General Enrollment Period. It's exactly 3 months long. Now for those people that want to enroll in Medicare that missed their initial enrollment period and they do not qualify for a special enrollment period, which is an SEP, then those folks beginning in January, it ends March 31st, they can enroll in Medicare using the general enrollment period. And if they enroll in the month of January, their Medicare effective date will be February. And if they enroll in February, it'll be March. And if they enroll in March, it'll be April. Now, typically, people that enroll during the general enrollment period end up paying a Medicare penalty because typically it's because they're late. They didn't do it when they were supposed to. Now, not everybody will pay a penalty. It just really depends on whether 12 months of not having Medicare Part B accumulated or not, because some people, depending on their birth month, may not get to that full 12 months. Now, we're going to get back to this general enrollment period later, because that actually opens up another enrollment period for somebody to get a Medicare Advantage plan or a private Medicare plan. Now, Medicare itself also has various numbers of special enrollment periods. Now, we call that an SEP. So to qualify for an SEP, you must have some sort of event, some special reason, some qualifier that allows you to enroll in Medicare outside of your initial or outside of the general enrollment period. And in this situation here, if you delayed your Medicare because you had insurance through your employer, then Medicare allows you an 8-month special enrollment period that begins when your group coverage ended or your employment ended and then extends an additional 8 months. So Medicare itself has a very long special enrollment period for people in that situation. Now, those are really only the ones we're going to cover for original Medicare. Now, what this training will mainly focus on is how do we get into private insurance programs using SEPs, IEPs, AEPs, so on and so forth. So we're going to zoom in and we're going to immediately eliminate the Medicare supplement option over here because Medicare supplements do not use enrollment periods. Only Medicare Part D plans and only Medicare Part C plans, which are Advantage plans, do. Now, depending on what type of plan you want to enroll in will depend on your 3-letter acronym. For instance, if you look at prescription drug programs, they have the annual enrollment period, they have special enrollment periods, and they have, of course, the initial enrollment periods. And Medicare Advantage plans are much the same, except there are some very specific enrollment periods that Medicare Part D plans don't have. For instance, the Medicare Advantage Open Enrollment Period or the Medicare Advantage Open Enrollment Period for new people. And we're going to dig into these one by one here shortly. Now, if I were just to show you the 10,000-foot view of what do enrollment periods look like? They're all going to fall into one of these categories here. Now, there is an exception. There's one called open enrollment period that doesn't have the MA in front of it, but we'll talk about that here just a little bit later. But these are the main codes that you are going to put on your application. So AEP, of course, for annual enrollment, MA OEP for Medicare Advantage open enrollment period, so on and so forth. So those codes there will actually go into your application, and then enrollment must approve that enrollment code in order for that application to be successful and go through. So we will break some of these down. Now, let's start with the one that most insurance pros already know and most prospects know, which is called the Medicare Annual Enrollment Period. So Medicare started this in 2006. You used to be able to enroll in a Medicare Advantage plan or Part D plan. It used to literally be just year-round. And then in 2006, with the introduction of Medicare Part D, they said, well, we want certain times of the year that you can do this. So they created what's called the annual enrollment period, where anybody that's already on Medicare, that already has some sort of private Medicare plan, can make changes. Now, let me show you, because we're going to have quite a few slides that look very similar. Let me zoom in here and just show you what we want to pay attention to here as we go through this training. So the when is, when can you do this? So the when in this situation is you can use the annual enrollment period between October the 15th and December the 7th. So you're restricted to those dates and those dates only. The code on the application is AEP, and the type of plan that you can enroll in is under the type here. So that means during that time frame, you could enroll in a Medicare Advantage with Part D, a Medicare Advantage without Part D, or a prescription drug program. Now, the frequency over here determines how many times can you use that AEP code during that date time frame there, okay? So this is a unique enrollment period because you have unlimited amount of times that you can use the AEP enrollment code during October the 15th through December the 7th. And the last app in received by enrollment is the one that will go through, okay? And then the use is, how do we use this enrollment code? So there's a lot of information over there to the right that we really need to pay attention to. So that really covers the Medicare annual enrollment period. Now let's move on to another one. This is called the Medicare Advantage, and the key word here is Advantage open enrollment period. So you can see this is from January 1st through March 31st. The code you will put on that application is MA-OEP, and the type of plan that you can enroll in is literally anything. However, it's different than the annual enrollment period because you only get one election. And once the effective date of that plan goes into effect, that election has been used for the entire year. Now, you must have a Medicare Advantage plan between January 1st and March 31st in order to qualify for this. So during that 3-month period, you can switch from Medicare Advantage to Medicare Advantage, or Medicare Advantage to an MA-only plan, that means doesn't have the Part D, or a Medicare Advantage to a prescription drug program, or even if you have a Medicare Advantage without Part D, you can switch to one that does have Part D. And if you're in a Medicare Advantage only plan and you just want a standalone drug program, you can do that too. But what all these enrollment periods have in common is you must have a Medicare Advantage plan in order to do this. So if you have a prescription drug program and it's January, February, or March, you cannot use the MA-OEP enrollment period. Now, a lot of you are already familiar with this enrollment period, but let me show you one that may have slipped by or one that may be new to you, okay? This is called the Medicare Advantage open enrollment period for newly eligible folks, okay? So this exists anytime during the year. Why? Because anytime during the year, somebody can turn age 65, okay, or be new to Medicare. And that's the key here. You cannot enroll into a prescription drug program. It must be a Medicare Advantage with Part D or without. You get one election. Now, this is really useful because have you ever run into somebody who's turning age 65 and you get excited, you have an appointment with them, and then they pull out a plan that they just enrolled in? Now, this enrollment period is perfectly suited for that person. Now, let me explain. So I'm just going to give you a case study here. So let's just pretend that today is August the 16th. And you look at their Medicare A and B card, and they're within the 3 months, right? Their A and B effective dates are June the 1st. But the problem is, when you had an appointment with them, they had already signed up for that Cigna plan on the left. And so you may be thinking, well, gosh, you've already enrolled using your initial enrollment period. What am I going to do now? There's nothing I can do with you. But that's not the case, because as long as they are within 3 months of the A and B effective date, and with this scenario of it being August 16th, we are in that 3-month window because their Medicare effective date was June the 1st. So that means that that person technically can switch, even though they already enrolled using their IEP, to a different Medicare Advantage plan. They can only do this one time, and again, it must be within the first 3 months of their A and B effective date. Okay? All right. Now, in general, we're going to talk about special enrollment periods, and those are a little bit trickier because there's so many different circumstances. But the code that you're going to start with is SEP, which stands for Special Enrollment Period. And the way my brain remembers it is they need a special reason, a special circumstance outside of the normal circumstances in which to enroll. Special enrollment periods can exist anytime during the year. It just depends on the situation. Of course, and you can use special enrollment periods to enroll into any Medicare privatized plan. And we're going to talk about specific special enrollment periods a little bit later. We're going to go through many of them one by one. All right. Now, we already talked about the initial enrollment period for Medicare. Now, once somebody gets their Medicare A and B, then they're eligible to enroll in a private plan. And their initial enrollment period, and sometimes it's an ICEP, it just depends on the situation. We typically use IEP in almost every situation, but we'll show you which ones you'll use ICEP, but it means the same thing. You get 3 months before, the month of, and 3 months after your Medicare eligibility date. So one of those is to get into Medicare itself, and then the second IEP truly is to get into a prescription drug program or a Medicare Advantage plan. So these are literally going to be your people that are turning age 65. Now, there's a very useful tool that you should carry with you at all times. It's called the Election Period Booklet. And this is downloadable in Boost. It's something that you should have on the hard drive of your computer or be carrying with you in your toolkit on every one of your appointments. Now, I like to use the one that United Healthcare provides, but other insurance companies provide them too. But for today's training, we're going to go by the United Healthcare book because I think they do a really good job. Now, if you want to know where you can download this, it's resourcemedicare.com, and then you're going to log into Boost. And then over here on the left side of your screen, you're going to see that there's a resources tab, and nested underneath there is a document vault. And within the document vault is the election period workbook, and you can download this, okay? It is not feasible for you to try and memorize all these enrollment periods. You're not going to be able to do it. Many of them remain the same year after year, but a handful of them change every year. That makes it hard to memorize, and the fact that there's just so many special enrollment periods and so many different circumstances, you're really going to need to carry this tool at all times. And when you open up to the inside page of your election period book, it's going to show you basically what we already put on a slide, the high-level 10,000-foot view of all enrollment periods, so we won't go through that right now. Now, if you turn to page 9 of that book, you're going to find out that there is something called a cheat sheet. I love the cheat sheet, because if you are looking for a specific situation, like in this case, an IEP 2, which means I was eligible for Medicare previously, but I recently turned age 65, you can kind of see the high-level overview in the code. Now, if you dive into it a little bit more, you'll realize that there's certain codes for Medicare Advantage plans and certain codes for prescription drug programs, and they do not always match. You can find that on page 9. Now, going back to that IEP 2 enrollment, if you want to dig into when is that actually able to be executed, you're going to turn to page 12. And from page 12 on, you will start to see what it means to use this enrollment period. Like, when can you use it? Because the cheat sheet doesn't tell you that. So page 12 and beyond, if you want to dive in a little bit deeper and figure out, am I in the available time frame to use this enrollment period, or you want to know more about it, or even some like supporting documents, you can find that all by turning back in your book a little bit further. Okay. Now let's go back to that IEP 2 enrollment period code. This can exist anytime during the year. So this will be executed from people that were on Medicare prior to age 65. And when somebody's on Social Security disability, we know on the 25th month they're going to get Medicare. They automatically get enrolled in Medicare. So if you get an opportunity or somebody schedules with you online and you see that their birthday is within 3 months of them turning age 65, you would get really, really excited, okay? But if they pull out a Medicare card and you see their A and B effective date, like this card right here is 1/1 of 2019, you might get stumped and say, well, what enrollment period would I use? They went on Medicare years ago. But because they're turning age 65, they get a second IEP called IEP 2. And they can enroll in an Advantage plan without D, and of course, a standalone prescription drug program, okay? So you can see those effective dates there, clearly years ago, but what's going to make them eligible is they're turning age 65 and they get another IEP all over again. So sometimes we have to ask the right questions when we're dealing with these prospects. Let's look at a different one. This would be for somebody that delayed enrollment into Part B due to having some other coverage, okay? So this is, if you're going to use this specific ICEP, this is for a Medicare Advantage plan or Medicare Advantage without Part D only. You cannot use ICEP to enroll in a standalone Part B. It begins 3 months prior to the Part B effective date, and it ends the last day of the month following the Part B effective date. And when you look at this card here, this might be an indicator of how you could use ICEP, right? In this case, you can see their Part A was a long time ago, but their Part B is pretty soon. And depending on how soon or if that date has come and gone will depend on whether you can use ICEP. Now, you're going to run into quite a few people that delay their enrollment into Medicare, and they had a good reason. They had coverage through their employer, and they were happy with it. But at some point, some people quit, or they go to retire, and this is an available enrollment period should you need it, okay? All right, now I told you we'd get back to this thing called the general enrollment period. Now, the general enrollment period, if you remember, was the enrollment period for people to get into Medicare Part B late. Remember, they typically will pay a penalty. Typically, not everybody, but most people will. So if somebody's enrolling in Medicare late, then you can use this SEP called GEP for General Enrollment Period, Part B. You can enroll in any plan you want. You can only use it once. And it begins when they submit their application to Medicare Part B, and it ends 2 months after the Part B enrollment starts. Now, just as a reminder, this is only for people that used the GEP to enroll in Medicare itself, okay? So, in fact, last week we enrolled a couple people using this enrollment period. And again, the effective dates here can only be February 1st, March 1st, April 1st, May 1st, or June 1st. Can't go beyond that due to the restriction of time between January 1st and May 31st. Let's look at another one. Now, a lot of insurance agents, you folks out there, are familiar with the whole Medicaid thing. And this has kind of changed over the years. Now, the enrollment period or special enrollment period that we get in 2026 is SEP dual / because it could mean something else. LIS means low income subsidy, meaning they have the prescription drug extra help program. And there's a status change, okay? You can enroll into any plan that you want from January 1st through September 30th. You get one election for this one change. It begins when they get the notice that there's a change in status, and it ends 3 months later, okay? And this is what it really looks like. There is a difference between Medicaid and extra help. A lot of folks get that confused. Those are completely two separate programs. Most people with Medicaid already have the extra help program, but there are people that have the extra help program that make too much money for Medicaid. But regardless of which program you have, and in some cases both, if there's any change, meaning I just got my Medicaid or my extra help, I just lost my Medicaid or my extra help, or I had a change in level. For instance, I went from QMB Medicaid down to SLMB Medicaid, or I was at the highest level of extra help for prescription drugs, and I got put on the second highest level. That is a change, and that means that you can use the change in status special enrollment period to enroll into a different plan. All right, now this one is one that you may not have heard of. Now, this one's a little tough because I want you to look to the bottom right-hand side of your screen. Now, this has to do with being in a nursing home or being institutionalized. And the enrollment period is different for the Medicare Advantage plan than it is for a prescription drug program. But the key here is the expected stay must be at least 90 days, which makes it confusing upon going into the nursing home, because that enrollment period begins the first day of admission or discharge. And a lot of times at admission, people don't know how many days that they're going to be there. Medicare says if you want to use this enrollment period, it must be at least 90 days. Now, that's a lot easier to determine on your way out of a nursing home because you'll already know whether or not you've spent 90 days there or not. And if you want to enroll in an Advantage plan because you've been institutionalized, then it's OEPI, that's Open Enrollment Period Institutionalized, or maybe you're being discharged. And if it's the enrollment is into a prescription drug program, then the enrollment period is SEP for Special Enrollment Period, and the key word is institutional, okay? Don't really use this enrollment period all that often. All right, now people that change their address or they move. Now, the code for this is SEP change in residence. Now, what determines a change in residence? Well, that period of time begins the month before the move. Now, let me tell you something. If you have not changed your address with Social Security, then this enrollment period will get denied. You must change your address with Social Security in order for that move to be official. Now, you don't even have to go a great distance. I've seen people that lived on County Line Road that separated two counties, and the zip code was the same, but the county changed because they moved across the street. Now, that's a relatively short distance across the street, but because in the northern county of County Line Road, because that was a different county, different Medicare Advantage and Part D plans existed, and it made that specific client qualify for a special enrollment period. So even if you just move a few feet, if a few feet of moving from one residence to another gives you a different number of plans in the new area, then you can use this special enrollment period, okay? Meaning you moved. Now, I've also had some people that moved, and when I got to them, they said, I moved 3 months ago. Now, if you look at the end date on this, you can't use this enrollment period unless it's been within 2 months of the move. However, when I asked them the question, did you change your address with Social Security? They told me no. And even though they were 3 months from actually physically moving, they hadn't told Social Security yet. So they went and told Social Security, they logged into their account, they said they had moved, and they put in the date as of the date that they reported it, and now they had an additional 2 months to enroll in a new plan. So SEP, change in residence, is one that you can really use. Or, if you're working with somebody, you're trying to figure out a special enrollment period, ask them if they've had a change in residence anytime recently. Now, this one we use quite a bit, okay? This is somebody that's leaving their employer group or union or retiree health coverage. Now, when you look at the stats of Medicare, there are 11,000 people a day turning age 65. And you may be saying, well, where in the heck are they? Well, nearly half of those people do not respond to any Medicare marketing at all. Why? Because they're not retired yet. They're still working. And when they are told about Medicare eligibility, they start to ask questions, and they normally begin at work with their human resources manager. And usually what happens is they say, well, you don't even need to enroll in Medicare. You can do that down the line because you already have coverage that's at least as good as Medicare's, and a lot of people won't respond. They'll just stay on the plan that they had at work, assuming that it's best for them. And the reality is, and we know this as insurance agents, the reality is most group health insurance coverage is not as good as what Medicare provides. So that's what these folks are not being told. So the people that do realize that, if they go into that Medicare journey a little deeper and just see how much Medicare will cost them, they'll leave that employer group coverage. In fact, most of the time we're able to show them an individual Medicare plan that literally is half of the out-of-pocket costs of what they're doing through their job, and they don't even have to work the 40 hours a week anymore to get that coverage from their employer. So you're going to see this one a lot. You can use it anytime during the year. The code is SEP, loss of EGHP coverage. You can enroll in any plan you want. You get one enrollment, okay? This enrollment period begins the month of disenrollment from the group plan, and it ends 2 months after their coverage ends. And a little note there at the bottom, this also applies to those who lose COBRA benefits, okay? So COBRA can qualify also for this SEP. Now, what COBRA doesn't qualify for in the world of Medicare is creditable coverage, okay? So in this scenario, if somebody has COBRA and they have A and B Medicare, absolutely no problem there. All right, now here's a caveat to this. Not only can you lose employer group coverage, but if you want to create a special enrollment period to help somebody else out, gaining employer group health coverage is a way to do it. So I have told a few people in my career that, hey, if you go out and you get a job at Walmart, make it just a temporary thing, work enough where you get access to their health care, that will create a special enrollment period. Work there a few months, quit working at Walmart. Now we've created an enrollment period to get you out of your situation. So the code is SEP gain EGHP coverage. And EGHP, by the way, stands for Employer Group Health Plan. It begins the month the plan is open to enroll in, and it ends 2 months after that plan starts. So having somebody just recently get employer group health coverage is also a special enrollment period. Now here's one. I recently involuntarily lost my creditable prescription drug coverage. Now there could be a number of reasons why that would happen to somebody, but this would be somebody that had some version of Medicare Part D and now they've lost it. Now I can give you one scenario that I can think of off the top of my mind. There are certain veterans, VA benefits, that is considered creditable coverage for Medicare Part D, as in drugs, even though it's not creditable for Medicare Part B, as in their health coverage. And some people that have VA coverage, it's based on income. It's not based on being disabled at the VA, and there are certain vets that will never lose their VA coverage, but there are certain vets that can, income being one of them. So if you got a veteran that has VA coverage and all of a sudden they're doing a little bit better, they go into a higher income category and the VA says, hey, we're not going to give you that VA coverage anymore, that would be involuntarily lost. That opens a special enrollment period. The code is SEP, involuntary loss of creditable coverage. Okay, this is for a Medicare Advantage plan with drug coverage or a prescription drug program. You can't do an MA only here. You get one election. It begins the month of the loss and ends 2 months later. Now, we ran into this in 2025 and the beginning of 2026. These are called service area reductions. The plan is just no longer offered in that area. So the reason we have a picture of somebody reading the letter there, it's because that's normally how they inform you. They will let you know that your plan isn't going to exist in the following year and that you need to make a change, okay? Now, they can make that change during the annual enrollment period, but if they miss that, and we had some people that missed their chance to change plans during the annual enrollment period. So this special enrollment period exists on 12/8 to 2/29 or 2/28 of the following year, depending on if it's a leap year or not, okay? So those are the folks that really missed the annual enrollment period. They have an extra, let's just call it, 3 full months to do something different. You can enroll in any plan you want. You get one election. It begins December 8th and ends the last day of February. Okay. Now, this is a different situation. Okay. And there's two different scenarios here. There's one that if my plan is ending its contract with Medicare or Medicare is ending its contract with my plan, then there's a special enrollment period for contract termination. Now, the time frames are different depending on whether it was with mutual consent of the termination. So in some cases, the plan and Medicare mutually decide that they don't want each other and they're not going to offer that in a certain area. Okay, that would be with mutual consent, which in this scenario would be 2 months before the termination and 1 month after. Now, if one of the two parties does not agree, meaning they're not mutually consenting that they don't want the other, then the enrollment SEP code is the same, okay? You still only get to use it once, but now it begins 1 month before the term and ends 2 months after the term. So just a little bit difference in the time frame in which you can do that. Okay, so you've probably seen this one a lot, where somebody's got a Medicare card with a retroactive start date. So some people will go to Social Security and they'll enroll in Medicare, and maybe they kind of did it last minute. And when they get sent a card, you realize that they just got the card, but that card says their Medicare effective dates were sometime in the past. So there's an enrollment period for that situation. Okay. Now, you can't enroll into a prescription drug program, a standalone prescription drug program using this SEP, but it's retro Medicare determination. Okay. It begins the month the notice is received. Normally, before somebody gets a Medicare card, they get a letter from Social Security that tells them you're approved and here's your start dates. Okay. That's why I always recommend using the letter as opposed to the card, because it will buy you more time, because the notice is the date of the notice of the letter, and the enrollment period ends 2 months after that notice is received. Okay, again, this is only for Advantage plans, not for Medicare Part B. Now, we're seeing more and more of these. I just read a report on the Kaiser Family Foundation. That's a great resource if you want to learn stats about Medicare and enrollment and who's doing what. But they saw a huge increase in the number of Medicare Advantage enrollees in 2026. And Kaiser pointed out that a lot of them were these chronic special needs plans. So There are certain Medicare Advantage plans out there, okay, that are based on you having a certain chronic condition. Some are based on lung conditions, some on heart, some on diabetes, some on all of the above, so on and so forth. Now, I put a little stat down there that's interesting. Did you know that 1 in 3 people that are on Medicare have diabetes? That means 33% of the population has some sort of chronic condition called diabetes. Now, you can use this anytime during the year. The code is SEP chronic. Okay, it's only a Medicare Advantage plan that covers Part D. They don't make MA only C-SNP plans, and you can't do this for a PDP. You get one election. Okay, it begins upon qualification of the condition and ends when enrolled. Now, the interesting thing about chronic special needs plans is when you write one of these enrollments, whether they have that chronic condition or not, they will get approved for the app. And the reason why is they're going to give that member a certain amount of time to verify the chronic condition. Now, the member actually doesn't verify the condition, the doctor does. Okay, so you could end up being in a plan like this for an entire month before they discover that, wait a minute, you don't actually qualify, and they'll send you a letter. But the fact of the matter is you've already been in the plan. Now, just keep that in mind before I show you this next one. So if you've got somebody that has a certain chronic condition, you can put them in a chronic condition plan, okay? Easy to do. And even if they long-term don't qualify for that, let me show you this other enrollment period here, okay? This is loss of the special needs plan status, okay? So you use this enrollment period. Again, it can be used anytime during the year, and you can get any plan. Oh, well, not any. You can't get an MA-only plan, but you can get a Medicare Advantage with D or a PDP. It's one election. Now, I want you to focus into the words here. I was enrolled in a chronic special needs plan, okay? So maybe they're cured of the diabetes, so I no longer qualify for that plan. Or, look at this. They couldn't verify the condition. And if that happens, they'll get a letter that says, hey, you can no longer stay in your chronic special needs plan. You no longer qualify. You don't have the diabetes like we thought you did. You don't have the heart condition like I thought you did. Well, that actually opens another special enrollment period. They get one election, and so when they get that letter of non-eligibility, that's when the enrollment period begins, and it ends 2 months after that notification. Pretty interesting. So here's how you might use that enrollment period. So you got somebody that really needs a non-special needs plan. They need a street plan with a low maximum. Maybe they're looking at, let's just call it, Mount Carmel, and they're in a different plan. So you could enroll them. Let me go back a screen to a special needs plan. They'll get that for the first 30 days, and then sometime in the first month or so, that plan will say, hey, you don't actually qualify for this. We're sending you a letter. You've got to get out of this plan. Well, check this out. With that special enrollment period, since they can't stay in the plan, they lost their SNP status, now you can put them on any plan, not just a special needs plan. So some of knowing special enrollment periods or enrollment periods in general, it requires a little creativity on your part. Remember, we're trying to create solutions for our clients to help them, and that could be one way to do it. All right, here's another one. I lost my Medicare Part B, and I no longer qualify for a Medicare Advantage plan. So how would somebody lose Medicare Part B? So I ran into a case recently where somebody had a Medicare Advantage plan with Part D, which means you need A and B Medicare. They got a letter. It said, you've lost your Medicare Part B. Why did they lose it? They lost it because they forgot to pay their premium. Now, if you're on Social Security, that's not a big deal. They zip out the Medicare Part B premium right out of the Social Security check, whether you want them to or not. Not your choice. But for those folks that are delaying their Social Security income payments for a later date, but also have Medicare, they will bill you quarterly. Now, it's pretty easy to miss a quarterly bill. You can really get tied up in life and things happen, and you could just forget to pay it. Now, the way you get away from that is on our website at resourcemedicare.com, you can download one of these forms called a Medicare Easy Pay form. And if you fill out one of these Easy Pay forms, Medicare will take the Medicare Part B premium automatically out of your checking account, and they won't do it quarterly, they'll do it monthly. So that's one easy way, is using the Easy Pay form to avoid that situation happening to you. So how does somebody lose Medicare Part B? Typically, they don't pay for it, or they forget to pay the premium. And in order to stay on an Advantage plan, you must have A and B Medicare. So if you run into somebody that law is losing their Advantage plan because they lost Medicare Part B, well, this is the way you get them a prescription drug program, because you only need Part A to get a prescription drug plan, all right? The code is SEP, loss of MAPD, and Part B can be done anytime during the year. And again, upon notification is when it starts, and it ends 2 months later. Now here's another one, and this one's pretty interesting, and it's especially if you have somebody that is undecided when they turn age 65 on whether they want a Medicare Advantage plan or they want a Medicare supplement program with a Part B, okay? Now we'll just pause here for a second. So this is somebody that at age 65, they used their initial enrollment period and they enrolled in a Medicare Advantage plan, okay? Now, anytime during the year, anytime during the first 12 months of them being initially enrolled into that Advantage plan, did you know that that consumer can change their mind and they can say, I don't want this Advantage plan? And right smack dab in the middle of the year, the end of however, wherever it lands, as long as it's within the first 12 months of enrollment, they can enroll in a prescription drug program. And the code is SEP65. So it begins when they enroll in that Advantage plan and it ends 12 months later. So you may say, well, what's that have anything to do with the Medicare supplement program? Well, what's interesting here is, did you know that people that when they turn age 65, if they choose that Medicare Advantage plan first, using their initial enrollment period, that gives them a full 12 months to get out of the Advantage plan and not only enroll in the prescription drug program, but they're also guaranteed issue on a Medicare supplement program. So that changes their open enrollment period for a Medicare supplement, okay, to a full 12 years instead of 12 months. So instead of 6 months of open enrollment, now they got guaranteed issue for the first 12 months. It's very strategic here. So you got somebody that enrolled in an Advantage plan, they feel like they made a mistake. You know, they don't like the network of doctors, or they don't like that it's managed care, they want to change their mind. It's 9 months later, they absolutely can disenroll, go on a prescription drug plan, and get guaranteed issue on a MedSup. But again, it's got to be the first 12 months of using their initial enrollment period of that Advantage plan, okay? Now, here's just an image to look at that. So they're going to look at the date of enrollment for that Advantage plan. And again, to get to that prescription drug program, anytime in the first 12 months, you got it. It's SEP65. Done and done. So this is an interesting one that I think some of our insurance pros probably aren't as familiar with. All right, now this is somebody that started with a Medicare supplement. So they're on a Medicare supplement plan, and they've done that from the beginning, okay? And now, somewhere along the line, they could have been 68, they could have been 70, they could have been 80, doesn't matter. If they've never been on an Advantage plan and they wanted to dip their toe into the water and try it, they are in what's called a trial period, okay? So if you're taking somebody off of a Medicare supplement and you're putting them on an Advantage plan for the first time, a lot of them get, that's a scary move, because what if I don't like this? Well, the good news is you have a full 12 months to change your mind. In that initial 12 months, you can not only just go back to the Medicare supplement plan as if you never left it, but you can also get out of that Medicare Advantage plan. And the way you get out of the Medicare Advantage plan is by creating that SEP, individual Medigap trial. You can only enroll in a prescription drug program. You can only do this once. It starts the first time you've enrolled in an Advantage plan, no matter what age that is, and it ends 12 months later. After that 12 months, kind of stuck there, can't use this SEP, but you could potentially find another one, or just wait till the annual enrollment period. All right, so I like to use veterans for this next one here. Okay, this next one, the code is SEP, eligible for other creditable coverage. Okay, now this enrollment period only applies to people that want to enroll in an MA only plan, meaning it has no drug coverage, and you can't do a standalone drug program. It's got an MA only plan. That's the only one you can do. You get one election. It starts whenever you execute it, and it ends once they're in the new plan. So this is what it means. I'm currently enrolled into a Medicare Advantage plan that covers drugs, okay, an MAPD, or they can have a PDP. Does not matter. And they have another option for prescription drug coverage that's available to them. So a good example is like a veteran. So if you have a veteran that's on an Advantage plan with Part D, or a prescription drug program with Part D, and they need out of that, and they need to change to something else, they can go on an MA only plan anytime during the year, okay? And they could do that one time. So I've used this quite a bit for our veterans. A lot of veterans like the MA only plans because some of them have a nice give back and gives them their Medicare Part B premium back so that they don't have to pay for Part B. That's a big motivator for a veteran. I should know because I'm a veteran myself. All right, this one, we in Ohio right now, Kentucky and Indiana, at least at the time of this recording, there are no 5-star Medicare Advantage plans. Now, a couple years ago, we had one. It was pretty nice. I think we had it for a year. But anytime during the year, okay, well, you can use this anytime during the year. The code is SEP 5-star. It's only for Advantage plans. You get one election. Now, it begins on 12/8, okay, and it extends to 11/30 of the following year, okay? Again, you can't use this for enrolling in a prescription drug program. Currently, in our area, we don't have any 5-star plans, so can't use this anytime soon. All right, we've seen this a lot too with the MyCare Ohio thing. My state enrolled me into a new plan, and I didn't even consent to it. It's crazy that that can happen, but it does. So if that happens, that person is awarded a special enrollment period. Because if you end up in a plan that you didn't agree to, of course you'll want out of it. I mean, you might like it, but the chances are you didn't agree to it. We don't know if they looked up your doctors. We don't know, okay? So if you need to get out of that plan, it's SEP CMS state assignment. Okay, you can have any plan you want. It can happen anytime during the year. You get one election, and it begins the effective date of the plan that you got enrolled to that you didn't want, and it ends the last day of the 3rd month. Now, we got this enrollment period recently. We got an email just about a month ago. Certain counties in Indiana, I think all counties in Kentucky and Ohio, and I hope I'm right on that, but this is a special enrollment period that Medicare will communicate to people that have been affected by some sort of natural disaster, okay? So there's a lot of flooding, for instance, in Kentucky. And so people may not have been able to do anything because they were displaced. And even if you weren't displaced, as long as you live in Kentucky, Ohio, or Indiana, you might be able to use this special enrollment period called Declared Disaster/Emergency. You get to use it one time, okay? And it's for any plan that you see fit to go to. Now, when this enrollment period begins and when it ends will be dictated by what Medicare says. So I just mentioned 3 states there, and all 3 states have different time frames of when it began and different time frames of when it ends. You'll have to know your specific dates for your specific area. But we've had a couple of situations recently where we used this enrollment period and it got approved because they just happen to live in that area. All right, now CMS has a icon, and that icon is like towards the left of your screen. It's a little upside down triangle with an exclamation point in it, and this is called a low performing icon. This will be on plans that have consistently been poor performing. What does poor performing mean? Meaning in the last 3 years, it's been 3 stars or less, all 3 years in a row. If you are currently in a consistent poor performing plan, then you get a special enrollment period called low performing. You can enroll in any plan you want. You get one election. It begins the date of the assignment and it ends once you're enrolled into the new plan. So that's 3 stars or less for 3 consecutive years in a row.